welcome to our show Health and Wellness Myths versus Facts. I'm Gargi Rawat. Obesity is one of the world's greatest health crises. Most of the world's population lives in countries where overweight and obesity can cause deaths, more deaths than underweight. While many obese people live with diseases such as diabetes because of their high BMI, not everyone realizes how much their long-term health is at risk. Obesity can significantly increase your risk of many diseases, and obesity and hormones are linked. There are some hormone imbalances that can contribute to weight gain. Promoting a healthy lifestyle, not just weight loss, and having an open dialogue with healthcare providers can reduce the likelihood of developing obesity or obesity-related health conditions. We have with us eminent endocrinologists to provide medically accurate advice on preventing as well as managing obesity. Joining us, Dr. Ganavi, YP, Assistant Professor and Consultant Endocrinologist, Department of Endocrinology and Metabolism, MS Ramaiah Memorial Hospital, Bengaluru. Dr. Sphoorti P, Consultant Endocrinologist, Nanjappa Multi-Speciality Hospital, Shivamoga, and Dr. Merugu Chandhana, Consultant Endocrinologist, AIG Hospitals, Hyderabad. Thank you so much, doctors, for joining us on the program to talk about this important issue and creating more awareness around obesity. Now, Dr. Ganavi, numerous glands throughout the body produce hormones. If you could first explain to our viewers what are hormones and why they're important for the normal functioning of the body.
Yes. So hormones are chemical messengers that coordinate the different functions in our body. They control many physiological functions as well as our psychological, treated by organs called the endocrine glands. They regulate the growth, our development, the metabolism, that is how our body gets energy from the food we eat. They regulate the sexual function, the reproduction, and even mood. Just to name a few, the common hormones which we deal every day include the adrenal hormones, the brain hormones secreted by the pituitary gland, also called the master gland. Then we have the pancreatic hormones, reproductive hormones, thyroid and parathyroid hormones. So coming to the second part of the question, why they are important for the normal functioning of the body. Hormones are powerful. With hormones, a little bit goes a long way. So it takes only tiny amount to cause big changes in the cells or even the whole body. That is why too much or too little of a certain hormone can lead to certain conditions that require medical treatment. When glands do not produce the right amount of hormones, disease develops that can affect many aspects of life. So some of the common disorders which occurs due to the hormonal changes include diabetes, which include type 2 diabetes, type 1 diabetes, and gestational diabetes. Then we have thyroid disorders, that is hypothyroidism and hyperthyroidism. Then we have irregular cycles caused by PCOS. Then we have male infertility, female infertility, and obesity. So ultimately, hormones control the function of the entire organs, and they also control growth, development, reproduction, and nutrient metabolism. So hormone stability can be a delicate balancing act, which is why if there are any issues, consulting an endocrinologist is very important.
All right. Now, Dr. Chandhana, is obesity a disease? If you could tell us that. And what is the difference between overweight and obese?
Yeah, good afternoon, everyone. So, as we all were talking just now, obesity has become increasingly prevalent all over the world, and especially in India. And if you look at the stats also over the last few decades, it has almost tripled in the last 3 decades. So it's a high time obesity gets its importance. And as of now, obesity has to be treated as a disease. Obesity is a chronic disease. It is a relapsing progressive disease which needs immediate concern, which is concerning because there are multiple other diseases which are associated with it. And this is when there's increased adiposity in the body, which is affecting the health. So in such situations, we need to manage the patient. And there are these two conditions which we are talking about, overweight or obese. So overweight and obese are some terms which people use interchangeably in a general public language. But in medical language, we have few criteria to define what is overweight and what is obese. So for that, we usually use the BMI. BMI is the body mass index, which is quite convenient to use. It is like weight by height square. And we have few criteria based on which we divide each patient, whether the patient has a normal BMI, whether the patient has underweight, or whether the patient is obese or overweight. So the criteria for Indian population is quite different from the Western population. So when we look at the Western population says that the overweight is more than 25, but in Indian population, a BMI more than 23 to about 24.9 is considered as overweight, whereas more than 25 BMI is considered as obese. And I would like to emphasize this, that yes, obesity is a chronic disease, and even the American Association of Clinical Endocrinologists has given a new term to it. It's called as ABCD, adiposity-based chronic disease, to emphasize that yes, this is a chronic disease and we need to manage it.
All right. Now, Dr. Pai, in the field of obesity medicine, researchers are becoming more aware of other hormones. What is the effect of hormonal imbalance on obesity?
Yes, as Dr. Ganavi has aptly put it, obesity is caused by a multitude of factors, not just your lifestyle or diet. And hormones do play a very important role in obesity or weight gain. So hormones are the one which maintain our body balance or the energy balance. So one of the hormones which can affect is the thyroid hormone. We have an underactive thyroid gland, which we call it as hypothyroidism. So hypothyroidism can also go on to cause weight gain to the extent of 3 to 4 kgs, and if the lifestyle is also bad, it can be even more. The other is the excess cortisol, which is a stress hormone. It is secreted when you have either physical stress or mental stress. This can also cause undue weight gain. Rarely there are certain tumors like the pituitary or the adrenal tumors which can lead to an excess cortisol secretion, and this has to be evaluated by your endocrinologist. The other commonly faced problem nowadays by reproductive age group women is that irregular cycles, menstrual cycles, which we call as PCOS or the polycystic ovarian syndrome. Here it is the ovarian hormones which are under imbalance. So there is excess of testosterone secretion which is going on, and this testosterone is bad for health. And the excess testosterone causes abdominal or tummy fat, which is not good for your cholesterol. This excess cholesterol can clog your arteries and cause heart attacks and strokes. And even fat tissue itself is an endocrine organ. It secretes hormones by itself. These hormones like leptin, adiponectin, etc. can also maintain your energy balance. They cause your satiety, what we call it as satisfaction when we eat food. So the hunger and satiety is also controlled by our fat tissue. So hormones do play a very, very important role in maintaining our body energy balance and weight.
All right, Dr. Ganavi, which hormone is related to metabolism and obesity?
So obesity is a very complex metabolic disease, as Dr. Sphoorti has rightly pointed out, and not just a problem of willpower or self-control. Having obesity or being overweight is not the patient's fault. Obesity results from a complex biology where the body increases the amount of fat. As a result, people with obesity, they crave more for calorie-dense foods and are more likely to store this extra calories as fat. The result is weight gain. The hormones for this are not yet well understood, but some of the hormones have been extensively studied. They include leptin, insulin, thyroid hormones, the cortisol, and the growth hormone. So these hormones play a role in the regulating our appetite, the metabolism, the body fat distribution, and also the storage of energy in the form of fats. So leptin is a hormone which decreases the appetite and increases heat generation. So in obesity, there is leptin resistance. That is, despite the levels being high in obesity, these individuals are not sensitive to the effects of leptin. Coming to the next hormone, that is insulin. So insulin is a hormone which is produced by the pancreas. It helps regulate the carbohydrate as well as fat metabolism. So insulin mainly causes the glucose from the blood to enter into the cells of the muscles, the liver, and the fat. So in obesity, there is insulin resistance. So that is, even though there is insulin levels which are normal or high, the insulin is not able to act. So that can cause, again, it does not cause fat breakdown. That is the function of the insulin. So when insulin is not able to act, it results in obesity. And insulin resistance can be considered as a hallmark feature of type 2 diabetes as well as metabolic syndrome. Also, the other hormones like the thyroid hormones, which regulate the metabolism. So that is in case of hypothyroidism, there is underfunctioning of the thyroid gland. That causes weight gain. Also, steroid levels, they tend to go up during stress, any inflammatory condition, and also a condition termed Cushing syndrome, which can result in obesity. Also, the lack of sleep can disrupt the levels of ghrelin, which is a hormone which increases our hunger, and it decreases the leptin level. That is a hormone which inhibits appetite. So this disturbances can increase the risk of obesity. So by and large, in obesity, the levels of hormones can be altered, which can lead to the accumulation of body fat by altering the metabolism.
Now, Dr. Chandhana, what are the various classes of obesity? If you can help viewers understand that.
Yeah. So as we were just now discussing that we have overweight and then obesity. So obesity is considered as a BMI which is more than 25. So a BMI of more than 25, and not everybody who has a BMI of more than 25 needs medical management. So in this, we divide them into few classes. These classes we decide and divide them so that we decide the treatment for the patient. So there are 3 different classes in which we divide the patients into. A patient who has a BMI between 25 to 29.9 is considered to be in class 1. If the BMI is between 30 to 34.9 kg per meter square, it is considered to be in class 2. And if it is more than 35, it's supposed to be in class 3. This is the classification which is given by the ESI, the Endocrine Society of India. And this is for the Indian population. This is the Asian population and even especially for the Indian population. This differs from the WHO classification because as Dr. Sphoorti will be talking about, the Indian fat distribution, Indian population's fat distribution is different. So even the lower BMI, the patients are at a higher risk for metabolic disorders. And also it's not just the BMI, because BMI is very convenient to use. This is one parameter which we use to define obesity, but there are other parameters also which we can look at. This is like the waist circumference, the waist height ratio, the neck circumference, and also we can also look at the other parameters. We look at the fat content in the body also. So that is done by tests which have been done in clinics. So there are multiple ways in which we can look at the patient's obesity level and manage the patient accordingly.
All right, Dr. Pai, now it is said that Asian populations develop negative health consequences at lower BMI than Western populations. If you could explain this to us and tell us why is this so?
Yes. So it is true that Asians or Indians develop negative consequences like cholesterol problems and heart attacks or strokes at an earlier age, almost a decade earlier compared to Western population, and also at lower BMIs. That is why we have a different cutoff from the Western population. So as it's already discussed, the normal is 18 to 23 for Indian population and it's 18 to 25 for the Western population. Why is it so? Because even with the same BMI, if you take an Indian and a Westerner, so the Indian has more body fat composition compared to a Westerner. So he has more of muscle mass which is there, and Indian has body fat. So this body fat is the one which is not good, especially the visceral or the abdominal fat, which can have negative metabolic consequences. So it can lead to dyslipidemia or the imbalance in cholesterol levels. It can have more of inflammation in your body, and this can clog your arteries and cause heart attacks and strokes. So this is why we say Indians or Asians should be more careful with our diet, and even at lesser weights and younger ages we are landing up with heart attacks, as we are evidencing nowadays.
Viewers, don't go anywhere. We'll be back with more questions for the doctors about this very important issue, obesity. Welcome back. You're watching Health and Wellness and we're discussing obesity and hormones today. Dr. Ganavi, is obesity inherited in the family? Is it a hereditary disease? And what preventive measures can be taken if obesity runs in the family?
Yes, thank you for the question. So obesity can be defined and considered as definitely a hereditary disease. So obesity is a complex heritable disorder. A lot of factors like the genetics, the epigenetics, and the environment play a role in its development. But some of the genetic causes of obesity can result in weight gain early in childhood. So these individuals, they often report excessive hunger levels, they're always preoccupied with food, and they have more than one family member who is affected with obesity. The most important strategies for preventing obesity running in families include a healthy eating behavior, having regular physical activity, and reducing the sedentary lifestyle. So examining these changes now and making reasonable changes are important. It is important to reduce the intake of foods which are highly processed, which are rich in sugar or calories, and to avoid sugar-sweetened beverages. Also, use of whole foods which are rich in nutrient-dense foods such as fruits, vegetables, beans, legumes, nuts and seeds, and also healthy plant-based fat is also important. Also, spending at least about 30 minutes a day in moderate physical activity such as brisk walking, learning portions of meals and snacks can also go a long way in preventing obesity. It is also very important to incorporate the physical activity in your everyday life. It is important to take stairs whenever possible, parking your car further out in the parking lot, walking your pet home, doing household chores, gardening, replacing screen time with family time. So last but not the least, having a good sleep hygiene is also very important. So studies have shown that people with a genetic predisposition to develop obesity, they have a greater difficulty in losing weight with traditional changes like the modification in the diet and exercise schedule. So in these individuals, they require medications or bariatric surgery to assist in weight management.
Right. Dr. Chandhana, obesity can cause various other metabolic disorders. Would you please clarify the link between obesity and metabolic disorders?
Yeah, thank you. So obesity, as we were talking, is actually a chronic problem, and this is associated with other metabolic disorders. The first thing which I would like to emphasize is the metabolic syndrome, which is a complex condition in which we have the patient having a high hypertension, patient has dyslipidemia, patient having impaired glucose tolerance, increased weight. So all these multiple things, these metabolic syndrome, this again can worsen, and then patient can develop other complications like diabetes. The patient can have cardiovascular diseases. The patient can develop NAFLD, which is called the non-alcoholic fatty liver disease. The patient can have, because of obesity, the patient can develop obstructive sleep apnea, osteoarthritis. The patient can also develop depression. So this is like a multiple complications and multiple comorbidities which can exist with obesity. So there's an interplay between obesity and these diseases. It's like a vicious circle. The obesity can worsen the insulin resistance that causes diabetes, and because of diabetes, and if the patient is not taking measures for that, then the diabetes worsens, the obesity worsens, and because of obesity, the patient can have obstructive sleep apnea. And because of NAFLD, the non-alcoholic fatty liver disease, which can progress on, and the patient can develop liver cirrhosis and even can develop hepatocellular carcinoma. So there are multiple complications which are associated with obesity, and finally, if you look down, the root cause comes down to obesity. Management of obesity, bringing down the BMI, bringing down the weight to normal range, can help in solving most of these problems.
All right. Dr. Pai, is it true that childhood overweight and obesity are associated with earlier puberty? If you could explain that.
Yes. So nowadays we are seeing a lot of children being obese, and this is called as childhood obesity. So this can go on a long way, so they can have obesity in childhood and it will continue in their adulthood also. One of the consequences is that earlier age of puberty, that is measured by age of onset of menarche in girls. So that is the first menstrual cycle which they get and that is called the menarche. So when we saw during our independence era where there were a lot of famines and malnutrition going on, there was a higher age of menarche which was there in our country, and over the years the studies in the 70s showed that the age of menarche was around 14 to 15 years, whereas recent studies in the 2000s and after that have shown that the age of menarche has subsequently come down, and it is now probably 12 to 12.5 years, and even lesser probably in metropolitan cities. And this is a consequence of better nutrition and weight gain. We are seeing that children don't have any physical activity, they don't go out and play, they are stuck to their mobile phones or TV, and post COVID this has drastically increased. Childhood obesity has become a rampant problem not only in metropolitan cities but also in the rural areas as well. And junk food like these chips which are there over the counter, they are available ubiquitously everywhere. So I think we need to pay attention to this childhood obesity, because this is the population which is going to grow up and they can land up with diabetes and other consequences of diabetes complications, which can be a huge health burden to our country later on.
Right. Now, Dr. Ganavi, what are the causes of emotional eating? If you could explain that to our viewers, and what are the complications also of emotional eating?
So emotional eating can cause obesity. So when you eat in response to emotions, it is called as emotional eating, which can be a sign of disordered eating. So any emotional stress can cause this. Any psychiatric condition affecting emotions, even depression, can also cause this. So it is more common in people who follow a restricted diet. In these individuals also, emotional eating can be commonly seen. So studies have shown that inadequate parenting can also be the cause of emotional eating. Also, genetic susceptibility has also been mentioned as a cause. So coming to the second part of the question, that is the complications of the adverse effects of emotional eating. It not only affects the mental health, but it can also affect the physical health. So it can result in the mental health being affected in the following ways, which include being preoccupied with food, feeling isolated, having difficulties in telling the difference between an emotional hunger and a physical hunger. So also it is mentioned that emotional eating is an automatic behavior. So the more the food is used to cope, the more established the habit it becomes. So stress in conjunction with emotional eating can increase the risk of diseases like diabetes, hypertension, heart diseases, as well as obesity.
All right, Dr. Chandhana, childhood obesity is an independent risk factor for type 2 diabetes, mellitus. How true is that, if you could tell us?
Yeah, so as we were just now talking, Dr. Pai was telling, so the prevalence of obesity in children has been increasing, and especially in the last 2-3 years, it's become really high, especially because of the COVID pandemic, because the kids have been sitting at home, eating home food, no physical activity. And right now, if you look at the prevalence of obesity in childhood, it's about 30% in Indian population. And this childhood obesity usually transfers into the adult obesity also. About 50 to 80% of the childhood obese kids, they also are obese as they grow into adulthood. So this obesity, again, as we were talking, the obesity causes insulin resistance, and this also causes adiposity rebound. So this causes an increased risk of diabetes. Childhood obesity, there are quite a few studies which have shown that it increases the risk of diabetes by almost 4-fold. So a child who is obese, the parents need to be concerned. They need to be concerned that yes, we need to make measures that the child comes back to normal weight, the BMI comes back to normal. The public awareness has to increase, because this is a major problem. This will worsen the diabetic epidemic which is happening right now in India. As of now, India is the diabetic capital of the world. So, and this is going to even worsen in future as the childhood obesity increases. So the measures we need to take is we have to make the schools should be more physical activity friendly. The physical activity for the children in school should increase. There should be more healthier options for the child in their lunch options. And even at home, the parents should take care that the child is more active. Especially in this era of internet, we need to be more careful, more vigilant, and make sure our future generation is healthier.
All right. Well, thank you so much, doctors, for joining us today and taking out the time and explaining all these issues to our viewers. Thank you all for watching. Goodbye.